Next, let's talk about the actual pathogenesis of an atherosclerotic plaque taking place. Let me explain this figure to you. So what we have here on top is going to be the lumen of your blood vessel, and here we're going to go ahead and refer to this as being the coronary artery. Is that clear? Now I want you to focus upon something here. You see that green endothelium? That is a cap, okay? And that is going to be a fibrous cap in which it's trying to house, in this case, it's trying to prevent that atherosclerotic plaque. You see where it says cholesterol and necrotic cellular debris? Well, it's building up in there, isn't it? As it continues to build, what is this? This is not hyaline or hyperplastic type of arteriolosclerosis. This is atherosclerosis. And I've referred to this as a few times. Now, with that atherosclerosis which is building up, did you imagine what then happens to that cap? At some point, that fibrous cap, which is made up of smooth muscle cells, made up of fibromuscular type of issues, then that cap may become so thin that it might just rupture. And if that cap ruptures, then what then happens to that necrotic debris that you see in the middle? It then is able to then escape, and then it embolizes. And if it embolizes, where are you going to go? Where are you right now? Good. You're in the coronary artery. And if you embolize, what then happens to the diameter of the coronary artery as you move distally? Obviously, it gets smaller. And so therefore, you have embolization of that necrotic debris in the middle. Distally, you're going to have complete occlusion. Wow. Isn't that myocardial infarction? Sure it is. So the protective mechanism of all of this at first begins with the pathophys. So step one, the endothelium, most commonly here, might then become injured. Wow, this goes back to those concepts of hemodynamics. What do you mean? Remember in hemodynamics with endothelial injury, what does that mean to you? You're then exposing the underlying collagen. That underlying collagen then is going to express what? You got this. Come on, tell me. Good. Your von Willebrand factor. So point is, if you damage an endothelial cell, are you not promoting thrombi formation? Of course you are. It's part of the Virchow triad, isn't it? Next. Accumulation of lipoproteins. Mainly what type here? LDL. Huh? What does LDL mean to you? LDL contains what? You remember this from biochemistry? Good. Cholesterol. Not triglycerides. Cholesterol. Is that clear? Keep it simple. Keep it clear. Always keep it clinically relevant. And you keep that in mind, you will never miss a question. Let's continue. Number 3. So what then come in? You see these are monocytes. Why am I having you focus on monocytes? What is that monocyte? Where am I? In circulation. Your monocyte is part of where? It's from part of your bone marrow. Remember, all of this is just a continuation, right? It's just a story. In your bone marrow is one of your granulocytes, isn't it? And so therefore, or should I say it's one of your agranulocytes, and it's actually part of your myeloid lineage. And so a monocyte, which is being released, it's traveling in circulation, but what do you call a monocyte when it gets embedded into a tissue? You now call this a macrophage, right? So now the monocyte, which then buries itself into the intima, which is then going to do what? It's going to do what? It's a phagocytic cell. It's trying to then consume. You see that necrotic debris, that right there in the middle, that center point? It's trying to consume it. So what do you call a macrophage when it's trying to then consume the cholesterol? It is then called, please take a look at, foam cells. Next, what do we have? Well, the factors released by macrophages, the platelet endothelial cells, all of this then is going to recruit the smooth muscle cells from the intima, or should I say from the media, towards the intima. And so therefore you're going to help form that fibrous cap. And that's exactly what you have here. Smooth muscle hyperplasia is taking place, extracellular matrix, and all of this is then going to further recruit more lymphocytes. And then finally, as far as the middle is concerned, this is the necrotic debris. You have created an environment where everything in there is then going to perish. And this is made up of what? Made up of your WBCs, lymphocytes, your macrophages, your foam cells now. You also have your LDL. And this LDL has now become oxidized, so for the most part, it behaves like what? It behaves like a free radical. Is that clear? This is the process of what? Atherosclerotic disease. Every one of these points, very crucial for you to understand, of developing atherosclerotic plaque. As you do so, then what then happens to the coronary artery? The coronary artery becomes more and more occluded. And depending as to the percentage, let's keep it at 70% as being the magic number. If it's less than 70% and you have occlusion, understand that you can still maybe supply enough blood to the heart at rest So the patient is not going to feel chest pain. However, beyond that, let's say there's 80-90%, and the patient is not going to feel pain even at rest. Welcome to unstable angina. We'll repeat this over and over again until we eventually get into what's known as a myocardial infarction. So now we've completed the supply aspect of our pathology. And what then happens when it's cut off?